Yeah, hello and welcome back to the first case of the month in the year 2021. A New Year's resolution to be a little bit more active again, but I'm sure you'll forgive me. We had enough to do the last year with keeping our businesses alive in Munich and in London, which we succeeded so far. So I wish you all, an okay time for the moment, and I'm sure you are all, as I am, looking forward to spring and then the summer to have a good pint in the pub and probably a nice Sunday roast. Yeah, today, back to dentistry, something we all like. The case of the month, January 2021. As always, big thanks to our dental technician, in this case, Mrs. Hagemoser, who's done a fantastic job here. And I come back with the things I think I can do best, which is single implants in the front. And I've shown you a few cases already. And the next 3 months gonna be single implants in the front, January, February, and March. Maybe something interesting, and you can really look forward to the case of the month in March, where I will show a new technique, a new approach how to place implants and have the temporary ready. This is a bit an old school approach, still worked, but we can have easier work in the future. So this is a picture already from the operation. I did apicectomies on the two central incisors a couple of years ago, I think 5 or 6 years ago, and they failed after approximately 3 years, or one failed on the right lateral incisor, and so the patient and I decided to take the tooth out and place an implant. So this is the first picture from the operation. First, just a normal circular cut, papilla elevator taking the gums off the underlying bone. And then you can see here why the apicectomy failed. You can see a small external resorption, and that doesn't look very clean, and the entire buccal lamella is gone. As you probably know my approach already, I'm gonna remove the tooth, clean up, place the implant, do the bone augmentation, one go place it temporary. We're conducting a scientific study at the moment to find out if the buccal placed artificial bone actually becomes host bone. Taking the tooth out, you can see here there are reasons why the tooth failed, and then clean everything up. And actually, it looks very damaged, but actually, if you have a close look, the mesial and distal bone is completely present, which promises us a papilla up to 5 millimeters from the tip of the bone, and only the buccal lamella is missing. Both neighboring teeth are okay. So we just need to replace the buccal lamella. So let's do that. Prepare for the implant, place the implant, in this case a T3 from Zimmer Biomed, one of my workhorses, and I use of course Camlock as well. So these are my two main implant systems, the Zimmer Biomed T3 and the Camlock, now the progressive line. Placing the implant, you can see buccal bone is completely missing, not a problem at all. Take the impression in the next step to produce a temporary in the lab on the same day, and check here if the implant has sufficient depth. It has, from the cemento-enamel junction, approximately 2 millimeters apically. We have to place the implant. Then impression taken, given it back to the laboratory, and then augment the bone. The original bone, which we take out when we drill for the implant, is covering the implant surface. Then bovine bone, or artificial bone of bovine origin, augmenting the missing buccal lamella. Always place a bit more, and in this instance a membrane on top of it, and then a connective tissue graft from the palate, and then stitch everything together. If you do that, if you augment more volume that originally was there buccally, you'll have a compromise with the papilla. Long term, not long term, but short term. So the papilla will come back after half a year, but in the short term, until that time, you have to explain to the patient that they have a little bit less height of papilla. So that's then everything stitched up. And you can see already the compromise we had to go. If we want to have buccal stability, we lose a little bit height of the papillas. You need to force them into position to close it. Maybe I forced them a bit too much here and exerted too much pressure, but I know from the publications of Dennis Dana from New York that this papilla will come back to 100% up to 5 millimeter from the bone. Sorry, this picture is horizontally flipped. Then the impression goes to the lab. They produce a wonderful temporary. You can see the position of the implant is completely sufficient. Comes out of the tuberculum of the incisor. That's absolutely perfect. So we can produce a screw retained crown. That's the temporary. Here's one thing is very important of the emergence profile, that you leave space mesally and distally for the papilla to grow. That's the temporary then on the model. And then the temporary in the mouth 2 weeks after the operation. You can see what I said. We will have a compromise with the papillas, but they will come back. Just memorize this picture now and compare that to the finished picture in a second. That's the x-ray. Implant placed in a correct spot. And then here the final crown. You can see already the papillas slowly come back. It will take up after half a year until they're completely back, but they will come back. Wonderful work by the dental technician. The left central incisor is a bit darker, but the patient didn't care that much. I suggested to bleach it internally, but she didn't mind it. So stable work, tooth is replaced nicely, and I would like to thank you all very much for watching, and yeah, please enjoy your time, and I wish you a good, let's say, second half of the year. Thank you very much. Bye bye.